Hi everyone, this is Mark Nisly. I'm presenting on the issue of nurse retention. Most of you have probably seen this picture of grieving nurses circulating on social media. I think most of us identify with the stress, grief, and burnout that comes at times with nursing. And I think we know intuitively that factors like these cause burnout and eventually worsen nurse retention, which in turn decreases the quality of care we provide to our patients. This presentation is an attempt to review the evidence we do have about retention and quantify some of those factors. Here are the objectives for this course. At the end of the presentation, the learner will be able to define nursing turnover, list 2 predictors of nursing turnover, and list 2 adverse effects of nursing turnover. Let's try to quantify some of this issue. Here's a definition of turnover from Duffield, Roche, Homer, Buchan, and Dimitris. It just basically says the transfer or resignation of nursing staff from their primary employment position. I'll just comment here that the literature mostly uses the term turnover to describe nursing retention, so that's what I'll be using for the remainder of this presentation. Here are some statistics to help you quantify the turnover rates in the United States. These were obtained by NSI Nursing Solutions in 2016. There was an 8.5% national RN vacancy rate in hospitals. There was a 16.9 median annual RN turnover rate, and a 28.9% of new hires who quit in the first year. I'll mention also that nurse aides had an even higher turnover rate of around 25%. A key question is, what are the factors contributing to turnover? This article by Maloney et al. Did an excellent job of showing some of the greatest predictors for turnover. They found that burnout and reduced employee engagement were the strongest predictors of turnover. However, on the right column, you'll see what caused the burnout and reduced engagement. High workload and high work-life interference had the strongest correlation with predicting burnout and reduced employee engagement. However, lack of challenge, lower self-efficacy, managerial support, negative working environment, and wages also were very influential in predicting burnout and employee engagement. And I'll just mention that these are very similar to what other studies have found that I read. How to address these issues is something beyond the scope of this discussion, but I think it's worth being aware of some of these potential causes to help prevent you from feeling like you need a new job. I'll also mention briefly there's a lot of evidence out there that shows that practice environment is significantly associated with patient outcomes. That means that advocating for the best practice environments is part of providing the best patient care we can give. What is the impact of turnover on healthcare and society? Here's a quote from the American Nurses Association in 2015, which describes one issue with nursing turnover. The link between inadequate nurse staffing and negative patient outcomes is well established. Poor, inadequate nurse staffing levels leads to higher rates of adverse outcomes, including hospital-acquired conditions, falls, hospital readmissions, and patient mortality due to surgical complications. In other words, poor staffing is a self-repeating cycle. It is a major contributing factor to burnout and therefore nurse turnover and poor patient outcomes. Another negative effect of high turnover on healthcare is summarized by this quote from the ANA. Basically, it contributes to a waste of healthcare dollars. The average cost of replacing a nurse ranges from $22,000 to over $64,000. However, I believe this is a conservative measure of the expenses incurred for turnover because this is only measuring the direct expenses. The last quote I will share is from Duffield et al. In 2014, and is basically just saying that decreased productivity of new employees was a significant component of the cost of turnover. Nursing turnover has become enough of an issue that there are a number of national and local government initiatives to reduce turnover. Our own state of Pennsylvania is actually actively pursuing a variety of measures to improve nurse staffing. This is especially interesting to me considering that the same report predicted that Pennsylvania would not be one of the states to have a shortage of nurses by 2025. I pulled this slide back in again to illustrate what for me is the most heartbreaking part of nursing turnover. That is the high personal cost to the individual. That 28.9% of nursing staff are not making it their new job. They're not making it to 1 year. And if these are new grads, that is even more sad. Another similar statistic by McHugh and Ma shows that almost 1 in 4 nurses are currently dissatisfied with their job. This represents a huge missed opportunity by these employers, but also a high personal cost to these nurses. In summary, nursing turnover is a disturbing problem that affects the quality of care we provide, healthcare expenses, self-repeating, and is detrimental to nurses. Being aware of the factors that contribute to turnover may help you be an advocate for yourself and other nurses, and ultimately help provide the best care possible to those in our care. Thank you for listening.